Professor Peña, thank you for agreeing to this presentation on assessment of and prescription of physical exercise in transplant recipients, which is intended for the students of our department, the Department of Exercise and Sport Science at the Mexico Highland University. These students currently taking the course Measuring and Evaluation of Physical Education, and I'm confident that your insight and experience will be a valuable contribution for their learning. I have the pleasure of knowing Professor Peña for several years. He has a wonderful person, has a wonderful family, and currently serves as a full professor at the Faculty of Health and Sports Science at Fundación Universitaria del Área Andina at Bogotá, Colombia, and currently is pursuing his doctoral studies in physical activity and sports science and technologies at Manuela Beltran University. And Master Peña continues to expand his scientific expertise while contributing to the academic and professional development of students and colleagues alike. And well, he's part of this topic is part of his areas of specialties. Thanks a lot, Professor Peña, for your time and for sharing with us this important content.
Okay, hi everyone. It's a pleasure to greet you. Before I begin with this presentation, I want to mention that this is my first time giving a presentation in English, so I apologize in advance if something isn't clear. But I will try to be precise and focused, and I hope the slide will help make everything clear. Today, I will talk about a topic I have been working on for the past 4, maybe 5 years as part of my doctoral training. Physical exercise in kidney transplant recipient, specifically resistant training. Before getting into the topic, let me introduce myself and explain how I started researching with this population. My name is Jhonatan. I am from Colombia. I am a professional in physical culture, sport, and recreation. I hold a specialization in physical exercise for health and a master's degree in physical activity and health. Currently, I am in the final semester of my PhD in physical activity and sport science and technology in Colombia. Well, from the beginning of my academic part, I have been interested in the relationship between exercise and health. I have conducted a lot of study with children, older adults, obesity person, and, for example, inactive adults, exploring how fitness relate to health and how exercise can improve it. In 2022, I meet ACODET, the Colombian Association of Transplant Athletes, and since then I decided to focus my doctoral research on this population. Well, to provide context, let us think of a kidney transplant recipient as a person who, after surgery, begin a new state of life. It's new life for this person. From a clinical perspective, the nephrology provide guidance by prescribed medication and monitoring the graph. However, when it comes to lifestyle, especially physical exercise, patients are left on their own. This creates doubts such as, for example, will exercise harm the graph? What time of training can I do? Can I do training resistant training or endurance training or concurrent training? Can I lift heavy weights, for example? Without clear answer, many adopt even more sedentary lifestyle than before that the surgery. And this is very documented in the report scientific. In contrast, there is now a strong evidence supporting the benefits of exercise in transplant recipients. This clinical guideline, based on 14 systematic review and 2 meta-analyses, show improvement in physical fitness, quality of life, body composition, for example, and even mortality rates. However, the World Health Organization reported that only one in 4 kidney transplant recipients meet global physical activity recommendation. The question is why? What is the reason? A qualitative study with 28 transplant patients conclude that the main barrier is fear of jamming the graft. In contrast, the main facilitator is having someone provide clear guidance on when can and can't be done. It's very important for this kind of people, a person to guide this process. This first slide highlight the need for a specialist to guide exercise in this population. It's very important thing for this kind of people. In Colombia, the context is even more critical. In 2022, a total of 822 kidney transplants were performed, making it the most common transplant solid organ in Colombia. Additionally, 3,328 people were on the waiting list, already meeting eligibility criteria, but without a donor. This highlights the urgent need to ensure the transplant recipient achieve high survival rates. This article in Spanish is in Colombian people present patent and graft survival in Colombia at 1 and 5 years. When compared the dates from the United States and European Union countries, we see a difference about 10% and 1 year and nearly 18% and 5 years. This highlights the urgent need in countries like Colombia, for example, to implement low-cost strategy such as promoting physical exercise to reduce these survival gaps. Now let's us focus on the most recent scientific evidence about exercise in kidney transplant recipients. Several meta-analyses, scoping review, systematic review, a clinical guidance demonstrate benefits across multiple health outcomes. For example, body composition, physical fitness. On this slide, I present 4 recent high-impact publications that support these findings. When review these studies, we find common points. All agree that exercise has large effect on physical fitness, for example, or physical indirect marketing on health. For example, in this meta-analysis, in a sample of over 622 transplant recipients, exercise was shown to improve VO2 peak and neuromuscular performance, for example. However, these are also limitations. Will a study show benefits that no provide clear detail on how to program and periodicize training load component? For example, intensity, volume, density, progression, and for example, movement velocity. These are key elements in exercise prescription. Yet, they are not well defined in scientific literature. To address this limitation, we formulate our research question. Who are lot components characterized in resistant training, specifically resistant training program for kidney transplant recipient, identify patterns and gaps that can guide evidence-based recommendation. To answer it, we conduct a scoping review. This scoping review is open access publication. This methodology has to analyze how training has been programmed in this population, rather than the focus on outcomes. We followed Prisma SCR guidelines, published the protocol in open access, and structured the study under the PCC framework: problem, concept, and context. This is a structure for a scoping review. We focus exclusively on resistant training program. The problem was kidney transplant recipient, the concept, resistant training protocols, and the context detail of resistant training programs. We searched for databases, PubMed, Web of Science, Scopus, and Science Direct, and apply strict eligibility criteria to ensure methodological rigor. We developed a search strategy replay across the 4 databases. In Excel, we register all possible load components. For example, volume, exercise time, intensity, progression, execution velocity, and more. 2, research extract the information, and 3, verified into consolidate the final database. Regarding a result, the flow chart show that we initially found 645 articles. After applying eligibility criteria and remove duplicates, 26 remain, and finally only 15 were included after full text reading, the most important study for this objective. Results were organized into 3 tables, and each table is present in 2 lines because were 15 study and 15 study. This first present general characteristic, for example, design, age, sample size, and post-transplant time. Maybe the most important thing of this table is the time post-transplant was 57.5 months, age range from 27 to 5-6 years. However, 10 studies didn't report this variable. This is the second table. The second table shows the type of training. We include a study with exclusive resistant training, another with concurrent training, but we only extract resistant training data. This is a very important thing. It also reports, for example, frequency, duration, number of type of exercise. A concerning finding what the many studies fail to report basic data, which reflect poor training planning. Finally, the 3 tables include intensity, volume, set and repetition, rest progression, executive velocity, and another characteristic. Most studies, maybe 6 or 7 studies, didn't report this element. In particular, 14 out of 15 didn't include executive velocity. This page is relevant and very important thing in resident training currently. From this table, we conclude three main ideas. First, high variability in training methodologies. All studies use different methodologies. Second, a strong heterogeneity in load periodization, lack of clear consensus on how to program training in this kind of population. Well, despite this, we found common point. This is the most important part of the conference because I will try to present some conclusion of this scoping review. We found common points that allow general guidelines. For example, first, it's better to combine resistance and endurance training rather than only use resistance training, as this improve adherence. Adherence is important thing in this population. Minimum dose at least twice a week, 30 minutes per session. Also, it's important thing that higher frequency and duration produce great benefits. Second part, regarding exercise type, most studies recommend using body weight or leg dumbbell exercise, for example, that suggests number of exercise is between 5 and 8 per session. As for intensity range, between 30% and 18% of 1 RM can be used. Training volume varies from 2 or to 8 sets per exercise with 10 to 20 repetitions per set. Excuse me. Okay. Rest interval range from 1 to 5 minutes. Progression begin by increased technical difficulty and later by adjusting intensity or volume. Excuse me. A key finding in that study is the execution velocity. One in the most important factor in resistance training has not been considered in the study. This aspect is not considered in resistance training for these people. Finally, this research led us to provide 3 lines of action. First is the most important, establish clear guidance for exercise prescription for this kind of people. Promote interdisciplinary collaboration between nephrologists, sport medicine people, and exercise professionals. And finally, consolidate exercise as a pillar of clinical care and health in transplant recipients. Well, thank you everybody for this time. Thank you, Dr. Hall, for the invitation. Again, I apologize for my English, and I will wait. All is was clear. Thank you.
Professor Peña, thank you so much for your time. On behalf of New Mexico Highland University, we truly appreciate your time, you sharing your knowledge and experience with us. I think in the future, the students that listen us, that see this important information, they are going to serve persons with these conditions or other disorders. So it is important they be prepared, and you deepen this information very clear. And guys, do you have any questions, any comment for Professor Peña? If you don't, we have um this one in here for you, Professor, on behalf of our department.
Is that the end?
Yes, this is the end.
So we just turn it in now?
Sorry?
We just turn in the study guide?
Yes, you can do it. Somebody can help me to read that for Mr. Jhonatan Peña? Ross, can you help me over here?
Yes, what do you need?
Just read it.
Certification of appreciation. The Department of Education and Sports Sciences at New Mexico Highlands University hereby presents this certification of appreciation to Jhonatan Camilo Peña in recognition of his valuable contribution as guest speaker for the presentation entitled Assessment and Prescription of Physical Exercise Science and Transplant Recipients, presented to the students of the Department of Exercise Sciences on September 17th, 2025, enhancing their academic experiments and professional development. We sincerely appreciate your time, dedication, and commitment to the education of our students. And then it just has a date
Okay.
inside.
Thank you very much,
Thank
Professor
you.
Peña, for this opportunity. And on behalf of New Mexico Highlands University students, we appreciate your valuable time, okay?
Thank you.
And
Bye bye.